Today, I'm going to talk about the radial nerve block. The radial nerve innervates the radial side of the hand. The target of this block is the superficial branch of the radial nerve. When combined with a median nerve block, you can cover most of the radial side of the hand. Positioning. The arm should be abducted and placed in a pronated position. The doctor sits on the lower side of the patient. Position the ultrasound video monitor on the upper side of the arm. The needle will be inserted in this direction. Generally, we use a 25-gauge needle to minimize pain. The needle size is adjusted based on the depth of the soft tissue. In this video, the orientation of the arm is displayed on the ultrasound screen. The left side represents the dorsal or radial side, while the right side represents the volar or ulnar side. In a static image, it can be difficult to identify structures, even for experienced hand surgeons. By moving the ultrasound probe proximally and distally several times, you can continuously observe the cord-like structure running parallel to the radial artery, which moves towards the radial and dorsal sides in the distal area. This cord-like structure is located proximally on the radial side of the radial artery, beneath the brachioradialis muscle. Follow the cord-like structure as we move the probe distally again. You can find the cord-like fiber near the radial artery in the distal area, just under the brachioradialis muscle. This structure is the superficial branch of the radial nerve. The key point is to identify the nerve in sequential frames, not in a single image. Let's review the anatomy. In the distal area, you'll see the bone cortex of the radius. The cephalic vein is close to the nerve. The nerve travels over the extensor carpi radialis and beneath the fascia of the brachioradialis muscle. Important caution: do not block the radial nerve in this area. Although the nerve can often be identified here, it lies between rigid structures like fascia and tendons. Injury to the nerve in this area can cause persistent pain for the patient. Again, avoid performing nerve blocks in this region. In the middle of the forearm, the nerve is still near the radial artery and is surrounded by flexor and extensor muscles. Let's move the probe further proximally. In more proximal areas, the nerve travels away from the radial artery. In this area, the superficial branch can be blocked safely. Using a smaller needle is important to minimize pain. On the ultrasound screen, move the probe towards the radial side to bring the radial nerve closer to the injection site. When the nerve shifts towards the ulnar side, adjust the angle of the probe relative to the forearm to make the internal structure of the nerve as clear as possible. The needle is inserted parallel to the plane of the probe. The nerve lies between the fascia of the flexor muscles. The injection target is the fat tissue surrounding the nerve bundle between the fascia. Injecting a small amount of fluid will spread the space around the nerve. Continue injecting to surround the nerve bundle with more fluid. You can see the fluid spread around the nerve. That's all for this video. Remember, do not identify structures in a single static image. Always identify the nerve in sequential frames. Do not perform injections near the wrist. Even slight injury can cause severe, persistent pain, such as complex regional pain syndrome CRPS. In another video, you can learn how to control the needle under ultrasound guidance. On this channel, I will continue to provide valuable basic techniques in ultrasound. Please subscribe if you are interested. Thank you for watching.